on hospital financing, let's bring in Dr. George Benjamin. He's the Executive Director of the American Public Health Association. Always good to see you.
Hi, how are you doing?
Good, thank you. So let's first start with the cancellation of a lot of these elective surgeries in some states. What impact does that have on hospitals' bottom lines?
Well, as you said, it's the bread and butter for hospitals. The elective surgery, hips, plastic surgery, the kinds of things that you routinely get done in the hospital, getting your gallbladder taken out. Emergencies are certainly very costly, but they're not the ones that really drive the revenue for a hospital.
And it's even understandable, obviously, that going into this third year of the pandemic, we're seeing burnout among a lot of this healthcare staff, nurses, doctors. Many hospitals are trying to up pay and benefits to try and sort of retain people, keep them on. What impact is all this actually having, though?
Well, staffing has been a big issue here. In fact, that's the rate limiting issue we're having right now, is getting enough staff, because a lot of them are getting COVID and they're going out because of being sick. And so they're coming up with innovative ways to allow them to come back to work quickly.
And a lot of people are, they're concerned if people feel pressured to rush back to work. Do we know anything about the pipeline of getting more nurses and more doctors trained up to be able to help in the fight against this pandemic?
Well, training is a big problem. Look, it takes many years to train a physician or a nurse. So the real solution is trying to get both allied health professionals to participate, nurse practitioners, physician assistants, and bringing in physicians who are administrators back into clinical medicine, and maybe bringing back retirees is a better way to do this in the short term.
And as we look at financing, we know that when COVID first hit in 2020, Congress authorized funding for hospitals. Was that enough, though, given that we're still in the throes of the pandemic? Has that money lasted?
Well, it hasn't, and that's one of the challenges that we have. There are discussions about putting more money and making more money available for the COVID response, but that remains to be seen whether or not that can get through Congress right now.
And do we have any idea of how much more funding is needed, and perhaps what else could be done to really supplement, not just with funding, but other things that hospitals and healthcare workers say they really need?
I think at this point in time, we need to focus on the workers. We need to figure out how to give them crew rest so they can be rest and ready to come back to work. We need to come up with enough tests so that we can clear them so they can return back to the workplace. I think the biggest issue right now is focusing a great deal on making sure that we have an adequate workforce, and then rapidly being able to pivot back to the routine procedures that hospitals are ready to do so that they can, quite frankly, improve their finances.
And in terms of how these things are structured, break down the non-profit versus for-profit hospital systems in the U.S.
Well, we have both nonprofit and for-profit hospitals. We generally have more nonprofits. The truth of the matter is the revenue for nonprofits and for-profits aren't any different. Basically, the difference is if you're a for-profit hospital, a portion of the profits go to stockholders. And if you're a nonprofit, all of the dollars that you make go back into the corporation. But they really function very much the same. Certainly, nonprofits are much more incentivized to take care of everyone, and for-profits hospitals usually do their broad mission and do provide some uncompensated care. But it's depending on where you are, it matters whether or not they can take care of all of the uncompensated care patients or not if you're a for-profit hospital.
And speaking of where you are, I want to talk about rural hospitals. So many closed in the years leading up to the pandemic. How are the ones that are still operating? How are they faring financially?
The rural health system in this country is really, really struggling. Not only are they're struggling because of COVID, but in many of the communities where they did not take the Affordable Care Act's Medicaid expansion, they did not get the benefit of those additional dollars for uninsured individuals. So I'm hoping that in the next several months to the year, people begin to think about taking Medicaid expansions in those communities, which will ultimately help their rural hospitals.
And is there any other sort of outreach that could be done if some of these hospitals have closed down over the years?
Well, people are looking at how they can put in place more community health centers and trying to entice primary care practitioners in going into those communities. Scholarships, for example, paying off their medical debt as they graduate is one incentive that people are looking at to bring those providers into rural communities.
Well, thank you. We do appreciate your insights. Dr. George Benjamin there, Executive Director at the American Public Health Association.